Hey, what if I told you there's no single best philosophy in healthcare policy? That might sound like a cop-out, but stick with me. The truth is, what counts as best depends on what you care about most. Is it fairness, impact, personal freedom? Let's break down the big ideas that shape how we think about healthcare and why each one matters. First up, egalitarianism. This one's all about equity, making sure everyone gets the same access to healthcare, no matter how much you earn or where you live. Imagine rolling out the red carpet for everyone equally. Think of the UK's National Health Service or Scandinavian universal healthcare systems. They aim to close health gaps and level the playing field. But sometimes, focusing on fairness can slow things down or limit choice, since resources have to be spread out and decisions get centralized. Next, there's utilitarianism. Here, the goal is to get the greatest good for the greatest number. Every dollar spent should make the biggest possible impact on public health. This is where you'll see things like cost-effectiveness scores and QALYs, those quality-adjusted life years that policymakers use to measure bang for buck. But sometimes, this approach might leave people with rare diseases or unique needs out in the cold, because the focus is on the majority. Now, let's talk libertarianism. This philosophy is all about freedom, letting individuals choose, pay for, and control their own healthcare. If you're a fan of market-driven innovation and personal responsibility, this might sound appealing. Private insurance, health savings accounts, these are libertarian favorites. The flip side, not everyone can afford the same level of care, and huge gaps can open up between the haves and have-nots. Then there's communitarianism. It's about shared responsibility, treating health as something we protect together. Think mandatory vaccinations or community health clinics. This approach says, we're in this as a team. It balances rights and responsibilities, but sometimes it can put the community's needs above individual choices, which not everyone loves. Finally, the capability approach. Here, healthcare is about more than treating illness. It's about giving people the real freedom to live lives they value. That means looking at education, housing, and the environment, not just hospitals. But it's harder to measure since it requires lots of different sectors to work together. Then, which one's best? Well, it depends. If universal access and ethical fairness are your top priorities, egalitarianism or the capability approach might win out. If you're chasing efficiency, utilitarianism is your guide. And if you value freedom above all, libertarianism is for you. In the end, there's no one-size-fits-all answer, just the philosophy that fits your values and the trade-offs you're willing to make. Which one would you choose? Let me know in the comments.